Welcome, everyone, to our quarterly webinar for the Parenting and Family Special Interest Group. This month, we're going to be talking about trauma, and we have with us Dr. Jennifer Serico. I am Dr. Corey Linneman. I am the chair of the Parenting and Family SIG for the year. I am out of Boys Town, the Center for Behavioral Health in Omaha, Nebraska. And Dr. Serico is coming to us from Baltimore, Maryland. She is a clinical psychologist and assistant professor at the Kennedy Krieger Institute and Johns Hopkins University School of Medicine there. Her clinical training and research interests are focused on evidence-based, trauma-informed, culturally humble care, and she works to improve outcomes for youth who have symptoms of emotional and behavioral dysregulation due to trauma. And she really emphasizes working and partnering with caregivers. She is a certified parent-child interaction therapy or PCIT within agency trainer, and she is a trainer for the Child Adult Relationship Enhancement or CARE program. So lots of qualifications. We're so happy to have Dr. Serico presenting to us today, and we look forward to hearing all about ways to support individuals dealing with trauma. If you have questions during this, I know she has some interactive points and ways to do that through technology, but if you have questions, feel free to write them in the chat and I will try to speak them for you, and we can get the best information we can to you guys today.
Thank you so much, Corey. Welcome, everyone. I know people are still trickling in. I know that my tendency is not to be able to make it to any sort of meetings or webinars until at least 5 after the hour. So we will have people trickle in. Corey did a beautiful job of introducing me, so y'all know all about me and what I do. And I am excited to talk to y'all today about trauma. We're really going to focus on identifying signs and symptoms of trauma and really thinking through what are the strategies that are helpful. I am going to use a more interactive approach. So rather than just sharing my slides, which is why we didn't have this closed out and then opening it up, I am going to have you all answer some questions at Mentimeter. So you can, once you're settled in, if you can go to menti.com and use the code 3364 2020. And I believe I can copy that and drop it into the chat. Oh, yep. Okay, I will do that. And then hopefully as people get started, they will be able to have this code. And just to answer some questions, this is definitely a webinar that was developed and designed with the intention of giving information to caregivers and parents. So that's really going to be my focus today. Of course, we know that often we have individuals who are providers who have joined us. So I'll want to hear a little bit about all of you and what you're all doing, and we'll use Menti for that. So the main things that I wanted to cover today are just defining trauma. Right now, we are living in times that are incredibly challenging. There is a lot of uncertainty in the world that can be incredibly overwhelming. It also means that people are talking about trauma a lot more. And so I think it's really important for all of us to have a good definition of trauma, a good understanding of sort of the frequency that trauma can happen, and the very variable types of trauma that exist. So we're going to spend some time talking about that, and then also talking about the signs and symptoms related to stress and trauma. And then talk a little bit about how to recognize a trauma response in children and adolescents, and think about utilizing strategies to support a child who has experienced trauma. Now, I could talk about this all day. Sometimes I do. So I'm going to do my best to keep myself accountable for time so that we get through the most important part, which is typically getting to the strategies that are most helpful. So if you have been able to join the mentee, I want to know who you are. Are you here because you're a parent, you're a clinician, you are both a parent and a clinician, you are someone else, maybe an educator, an aunt, an uncle, you have some role that felt important to learn more about how trauma can affect children and what you can do to support children who have been impacted by trauma. If those of you who identified yourselves as other want to drop in the chat what brought you here, I would love to know. If not, I also understand. It's lunchtime, you're probably trying to eat. Maybe it's morning where you are. I don't know. So I understand there are competing priorities. So we have some parents, many clinicians, and some other. And I'm sure that we will have other people join us. And I know sometimes joining joining the mentee can feel challenging.
So Dr. Serico, in the chat, we have someone who said other, who said they are a parent of a grown child, a 26-year-old.
Okay.
We have a researcher, and we also have someone who is a professor, a researcher, and a parent.
Great. Well, thank you so much. And I am glad that you all are here, regardless of your role, and hope that all of you will find this helpful today. Okay, so my next question for y'all is, what is trauma? I'm sure that many of you have heard the term trauma time and time again. And like I said, there are all of these different definitions going around of trauma. So if you have ideas about what trauma is, I would love for you to drop these in here. Okay. Distressing. Yes, definitely. Thank you, Erin, for dropping the link back in. So trauma often comes after an event that has been very distressing and it leads to distress. It can be driven by adversity. It's a response. It happens after there's a threat to safety. So these are all great definitions of trauma. A negative event that happens. Fear. It's definitely a big part of the response to trauma. Threatening. So we have a couple of those things around threat to safety. Great. So when I think of trauma, the definition that I find most helpful, and I've actually done a lot of trainings on trauma over the last 10 years. And the definition that I've used has changed as the definition in the world has changed. And so this definition, developed by SAMHSA, is an event or series of events or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has a lasting effect on the individual's functioning and their mental, physical, social, emotional, or spiritual well-being. So I think there's two really important pieces here, and it is that something happens that is harmful, right? And that there are lasting events. So there are a lot of things that can be traumatic, and what can be traumatic doesn't always mean that it has that lasting impact. And so, especially as parents, when we're paying attention to what is my child experiencing, what's happening here, when we know that they've been through something that we see or experience as really harmful, trying to pay attention to how is that impacting them? How are they functioning? Right? So we want to be able to pay attention to those things to really figure out, is this a trauma impact, right? Yes, what they experience might be defined as trauma, and is it trauma for my child? So, how do we figure that out? Well, first we have to know what kinds of experiences are traumatic. Traumatic events can happen at different frequencies. So it's good to know that they can be acute, right? You can have a one-time traumatic experience, and that can have that same impact as chronic trauma, which happens time and time again. Or as complex trauma, which is usually a combination of traumatic events where there are multiple trauma experiences, and often those are interpersonal in nature. So when we think about these different types of traumatic experiences, each of these experiences might be happening one time, or might be happening in an ongoing way, or might be kind of layering on top of each other in this more complex way. So, those experiences can include those acute traumatic events. When we think about acute traumatic events, we're thinking about things like a car accident or a one time assault, right? When we're thinking about complex trauma, like I said, it's that layering of traumatic events, and they are often interpersonal in nature. And what typically happens when we think about complex trauma is that it really impacts trust, safety, and relationships. And that's true for most trauma responses, but particularly true when there are complex trauma responses. Collective traumas are things that happen to an entire society of people. So, regardless of their cultural identity or racial identity, all people have a traumatic experience. So, that could be because you live in a place where a war is going on around you, and that is happening in many places around the world right now. It could be the pandemic, right? If somebody had a really significant response to that, that entire experience was a collective trauma, and having that response would mean that a traumatic response had occurred. Intergenerational trauma is trauma that's passed through the generations. So, one family member many generations ago experiences trauma, and then that impacts how they parent. It can also start to have an impact on the genetic code. So, epigenetics are starting to show that intergenerational trauma can really have this larger impact. Historical trauma are traumas that happen to a group of people, right? Usually that's identified based on race or culture. And we think about historical trauma and events like slavery, forced relocation, those kinds of things. And when we think about historical trauma, it's kind of like someone is wearing an invisible backpack. And as they're wearing that backpack, they're collecting these stories about their people, right? And those stories start to bear that weight that trauma bears. And so often it's hard to identify where that's coming from, and it comes from that historical trauma. Racial trauma includes experiences of discrimination, so based on racial identity. And so that can stem from multiple experiences of discrimination, or can be based on one really significant experience of racism. Life transitions are things like job loss, homelessness, those kinds of things that can have a real impact on someone. And again, are different kinds of experiences that can then take on that role of being a trauma. And then vicarious and secondary trauma for people who are working with individuals where they are either directly witnessing traumatic experiences or hearing stories of traumatic experiences, they too can start to have that ongoing impact in their everyday functioning in these different areas as a result of those experiences. So we have these different realms of experience that can happen in childhood, all that can be adverse, right? And so for many years, there was a focus on some really great work from Wendy Ellis and her group that really looked at sort of that tree, right? And the roots of the tree. So, where you have these things that can happen, divorce, homelessness, these adverse childhood experiences, things that had long been defined as adverse childhood experiences, but then the roots of those experiences. Why are some of those things happening? And why are they happening more to certain groups of people, right? Often to marginalized communities. And that's because of the impact of systemic racism, right? And so, really thinking about those experiences of discrimination, substandard schools, historical trauma, violence, lack of social capital and mobility, structural racism, poor water and air quality, lack of jobs, these kind of community level experiences that are the roots of often where those household experiences might be driven from, and that those two can be so deeply linked. And now we also have to pay attention to the added impact of environment, right? So recognizing that the impact of the climate crisis and of the increase in natural disasters and how that continues to add to these adverse childhood experiences and increases the risk for a child to have these experiences. So I actually just realized that in the Menti, I'm not sure if I can play this video. And given time, it might not make sense to play the video. What I want you to know is that this video talks about, and I will include the video, I can send out some resources at the end. The video really focuses on the impact on brain, body, and behavior, and the way in which the role of the caregiver or parent is essential in being able to help a child who has had these adverse childhood experiences. So when we think about trauma, right, we are recognizing that there is this event that occurs. It can be any of those experiences that I've talked about. It can be any combination of those adverse childhood experiences. And what happens is that a child has that experience, and then they have those symptoms that come out of that, that impact them in these different areas. It can impact their physical health, their brain development, their cognition, learning, and memory, their behavior regulation, their emotion regulation, and their relationships. And when we have that impact, and when that starts to show up in their everyday functioning, then it is really considered a trauma response or a trauma reaction. And that's when we're starting to look at, what does this child need? What do they look like, right? So we have all of these different diagnoses that we can use when somebody has experienced trauma or stress and is then exhibiting a change in their behavior, a change in their mood, and having that impact on their everyday functioning. And we have these different responses developmentally, right? We know that trauma impacts children of all ages and that there are these similarities and differences in the way that trauma manifests across age groups. The stage of the development can reflect the response to trauma, and often what we're seeing are still these really significant changes in mood and behavior and how a child or adolescent is thinking about the world, right? And so we really have these four major areas, and it can show up in all of those different ways, right? So, in how a child is interacting with other people, very often what we see are changes in emotion and behavior regulation, right? So those are some of the first signs that we start to see, is that more often the child, our own child, might be starting to get in trouble at school more, right? Or might be really, really difficult to manage at home. They might be seeking out some higher risk behaviors that could impact their health, right? If a child experiences neglect very early, right, we have those very clear indicators of how that impacts brain development. So when you think about a neglected baby, you're often thinking about this infant crying out for help and those synapses in their brain kind of firing off, right? It needs to connect, it needs to figure out what happens when I cry out for help. And often, what happens for a neglected infant is that there's no response to that. And so you can think there about, what does that mean in terms of the connections that are being made in that infant's brain, right? When I cry out, nothing happens. Crying out is my inherent, like the way that my body was designed to get the attention that I need. And when that's not happening, that's going to impact the brain development. And if things like that happen, then we think about, how does that impact how somebody learns or how somebody thinks, right? When a child experiences trauma and they're constantly having reminders of what happened, even when they don't want to, that's going to impact their memory, right? It's going to impact their ability to recall certain information. If they dissociate, right? If they can't remember what happened, their brain finds a way to intentionally block out what's happening when they're going through a traumatic experience, for example, physical abuse or sexual abuse, right? Or many of those other things that I talked about. If a child does that, that's going to have an impact on how they recall information, right? And again, then isn't it harder for them to regulate their behavior, to regulate their emotions, right? So all of these different areas get impacted, and we see the impact in that everyday functioning across these areas. So when we see these responses, right, we often see these behavioral responses, like I said, increase in disruptive behaviors, increased irritability and mood swings, sleep difficulties, difficulties concentrating and paying attention, problems with learning new material, memory difficulties, compliance difficulties, aches and pains, sadness, anxiety, depression, fear, hopelessness. And what do youth who are exhibiting these difficulties need? Often what they need, especially if these symptoms and behaviors are showing up as a result of trauma, they need extra patience and support from the adults interacting with them. They need that extra attention paid to their relationships. And that can feel really, really difficult when a parent or caregiver is dealing with their own stressors and challenges. So, when we're thinking about how to respond, it's helpful to keep in mind what is trauma informed care. This is another phrase you hear thrown around, and I know many of you are actually providers or researchers. And so I'm sure you've heard this term trauma informed care. And what does that mean? It means realizing the impact of trauma, like we just went over, and then thinking about what does healing look like? What does recovery from trauma look like? Recognizing the signs and symptoms of trauma in our own families, in the families that we work with, right? Responding by integrating knowledge about trauma into policies, procedures, and practices. So, if we're thinking on a family level, what does that look like? How do we respond by integrating knowledge about trauma in our family practices and our routines and what we're doing in the day to day? And then, how do we seek to actively resist re traumatization? So we have those kind of ideas about trauma informed care. And then there are these principles. How do we put those ideas into action, right? And so one way to do that is create and increase the sense of safety. For a child who's experienced trauma, things feel incredibly chaotic and overwhelming. They don't know what to expect because the totally unexpected happened and disrupted their everyday functioning, right? So, creating ways to help them feel safe is so essential. One way to create safety and enhance safety is to build trust, right? Being honest, having open conversations, being able to strengthen that trust so that they can tell you about the kinds of things that they've experienced, or they feel safe to share those things with you. Being able to strengthen and enhance opportunities for peer support, a sense of community is such an important way to heal from trauma. And so really thinking about how can we enhance that peer support. Thinking about collaboration and mutuality. What are the things that we're doing to work together towards common goals? When we're making decisions on behalf of our children, how are we giving them options? How are we giving them a voice and allowing them to make choices? Right? And how are we recognizing the role of identity? Are there factors of their intersectional identity or of our own intersectional identities that are increasing their risk to trauma, that are making it harder for them to heal from the trauma that they're experiencing, because that might impact access to certain ways to heal, to community, right? To peers. So, really thinking about how do those principles impact how we are then providing that support at the family level, right? Because there are lots of different things that can happen. There are things that can happen within the community. There are things that can happen within the school setting to enhance trauma informed responses. And there are things that happen at the family level. And that's why y'all are here, is to think about what are the things that we can do at a family level to really enhance that trauma-informed response. And so when I think about the tools that are most essential for caregivers, and this is from reviewing lots and lots of literature and really doing some in-depth review of what's available, what's evidence-based, right? And what we know are that there are a lot of treatments that focus on child trauma, some that have more support than others. There are a lot of treatments that focus on childhood behavior, and there's not a lot that looks at the overlap of child trauma and behavior, even though what I've just been talking about is that when a child experiences trauma, a lot of times that's coming out behaviorally. A lot of times what we're seeing is a child who's having more tantrums, who's engaging in more high-risk behaviors, who's having a really hard time getting through the school day without getting into trouble. As a parent, that makes us more exhausted, more frustrated. It creates more challenges for us where we're trying to balance how much am I making excuses or trying to help somebody understand what's happened for my child, and how much am I having to discipline them more, right? And so the more we understand trauma as parents, the better we're able to know how to respond. And because right now what's available doesn't provide that overlap for us, what are the skills we need to do and use to manage our children's behavior in more effective ways? And to be able to do that, that means we have to be able to regulate ourselves as parents. And that's often the hardest part, right? Because we can learn about trauma, we can understand how it's impacting our child, we can make sense of it in our minds. And that doesn't always mean we can use the tools that we have to help our child feel more safe or to build trust with our child, especially if we're not feeling regulated ourselves. And if something has happened to your child, of course you're not feeling regulated. Of course you're exhausted and sad. You're experiencing what, in my impression, are like the most uncomfortable emotions, like guilt and shame. Because as a parent, often the most important thing that we are trying to do is just keep our child safe. And when we don't do that, not because we did something intentionally, or even sometimes because we did do something intentionally, right? Then it impacts us too. And so building our ability to regulate ourselves, learning about trauma, managing our child's behavior, and using those three in conjunction are really important tools to be able to create a healing environment for your child. So how do we do that, right? What are the things that we need to do? How do we educate ourselves about trauma? Sometimes it's simply about learning, right? We're reading more books, we're looking things up, we're watching things where there's, whether it's a movie or a TV show where it talks about trauma, and just trying to make sense of it. What does this mean? What are the outcomes? What's difficult right now, and I already sort of addressed this, right, is that we're living in a time where it is very hard to know what is good information and what is not great information, right? And that's true about parenting generally, right? It's especially true about learning about trauma. And so, really finding some tools and resources, and I'll share some of those with you, but just to kind of name one resource that's incredibly helpful, the National Child Traumatic Stress Network, and I'll include the link for y'all. It is on a slide later. It is a great place to find resources for yourself as a parent, for those of you who are providers in a variety of different settings. Also, a great way to access education on trauma, and particularly on trauma for children and adolescents. Um, and so really kind of figuring out what's a good resource and how do I get my information from there, rather than kind of being dependent on a Google search or AI or social media to educate me on trauma. And then creating space for your child to talk about their feelings, right? So we want to recognize what do we know about trauma? What do we know about the impact of trauma? And we're going to educate ourselves as parents in that way. And then we also want to know what's happening with my child, because we want to be able to differentiate between they had this bad thing happen and they're actually, kids tend to be pretty resilient. So you might have a child or you might be working with a child who is okay, right? And you want to be able to assess and be able to check in. And if you can create that space and build that trust, and enhance that sense of safety, then as your child is talking to you about their feelings, they're going to be much more likely to be able to say, you know what? I am feeling really bad about this, or I am thinking about it a lot. It's really bothering me. Or I was doing something the other day and I saw this thing, and all I could think about was that bad thing that happened. Right. And so the more your child feels safe to talk to you, the more you're going to be able to figure out, are these signs and symptoms related to that traumatic experiences that they had? And then sometimes you might not see it at home, especially if your child knows that you are feeling guilty or bad about it. They might work really, really hard to hide the how they are doing from you. Because just like you want to protect your child, often after bad things have happened, children want to protect their parents and caregivers too. So check in with the other people involved in your child's life. Find out how they're doing in school or other settings. Are they part of any teams? Are they doing anything else in the community? How are they showing up there? Do they take the bus to school? What does the bus driver say about their behavior, right? They're probably the first person who sees them in the morning. Um, so really thinking about, my kid is at all of these other places throughout the day. And so what does that mean for them, right? And how are they doing in those other places? Because it's possible they're working hard to hide how they're feeling or how their trauma has impacted them from you. And then what do we do to manage their behaviors? One of the most important things that we can do is strengthen the relationship, right? And there are lots of different things that we can do to strengthen that relationship. One thing is creating some time individually. It does not matter how old your child is, creating the space and the time to connect with them, doing something that they enjoy is an incredibly powerful tool to strengthen your relationship. Even if they say, nah, I'm not doing this today. I have no interest in playing with you or watching this show together or cooking dinner or going for a walk, whatever it might be, right? That's fine. You keep showing up, you keep letting them know you're creating that space and time, and they will start to engage, right? And that gives you those opportunities to have those conversations, to find out how they're doing. And you can do that without asking a lot of questions, which often put a lot of pressure on a child or adolescent and make them feel like they're being interrogated, right? Especially if they've ended up having experiences either with child protective services as a result of their traumatic experiences, or with the police, right? So, really being cautious about using some other skills and strategies to connect with them, really trying to listen to what they have to say, trying to reflect back or validate what they're saying, right? Finding things that you like about how they're behaving and giving them that positive reinforcement for that. All of those things are going to strengthen the relationship and build trust. The more that you can maintain structure and routines after a traumatic experience, the better. That can be really hard because you're also feeling overwhelmed. And so, the more that you can figure out, how do we return to our routines? How do we keep that structure in place? A lot of times, as a parent, the initial reaction is drop everything. I'm all the way in on my child. This is the only thing I can focus on. And I'm just going to give them everything that they want until they feel better. Like I said before, a child who's experienced trauma is overwhelmed. Things are chaotic, right? They don't know what to expect. So, taking away what they expect, taking away limits, actually is harder for them. It's confusing, it's stressful. And the last thing that we want to do is increase that stress. So maintaining those structure and routines is really, really important after a child's experienced trauma and always, right? As a parent or caregiver, we know how important those things are. And then again, a lot of times I talk to parents and caregivers and they say, I just, no consequences are working, nothing's working, right? Or I don't feel right about giving my child a consequence when they're coping with this thing, when they're trying to heal. And like I said, those limits are still really, really important because limits allow a child to feel safe. In fact, having those limits really keeps a child feeling safe. We often use a metaphor in one of the multifamily groups that we do, and we talk about how limits are like fences, right? And you set up fences and you want them to be sturdy, right? You want them to create a real clear barrier so that the things you want to stay in your space and in your home stay there, and the things you want to keep out are able to keep out. And that's true with the limits that we set as parents, right? We are basing those limits on our values, on the things that we care about, respect, right? Kindness, right? Humor. What are the things that you want to keep in your home? And where do you set those limits and follow through with consistent consequences when the behaviors that you're seeing are not in line with those values? So we really want to think about those pieces. And again, keeping those limits, having those consequences is still really important because it creates that sense of safety. And like we said before, we're also wanting to take care of ourselves. How are we regulating our own emotions? What are the things that work for us to take care of ourselves? I mean, right before this, I was in my own therapy session. I was rushing out of my therapy session because I had to get to this. And that's something that even if I only do it once a month, it creates some sense of calm and consistency. Now, therapy is not accessible to everybody, and I totally understand that. I carry a lot of privilege. And so, recognizing that what are the little things that you can do for yourself? Maybe it's making yourself a cup of tea after your children have left home for the day. Maybe it's building in just 15 minutes of a walk or some other kind of exercise. What we know for the most basic ways to care for ourselves that will help us improve our self regulation: sleep, eating, hydration, right? Those are the things that as parents, it is easy to forget to do, right? Or our child isn't sleeping through the night because they're having nightmares. So, how can we possibly get enough sleep? Really thinking about what are the very basic ways for us to care for ourselves, because if we're caring for ourselves, then we are able to regulate our own emotions better, be able to follow through on those behavioral regulation strategies that I just talked about, and really have the capacity in those moments when we need to think about what is my child's behavior about right now, and remind ourselves, you know what? I learned that my child is going to struggle with behavior regulation because they've experienced this event. It can be hard to remind yourself of that when you are dysregulated, when you haven't had enough sleep, right? So, really thinking about what am I doing to take care of myself so that I can better regulate my emotions when my child is having a tantrum because they also didn't sleep because they had nightmares, right? Or because they got into a fight because they were in that fight or flight response. So we really want to be paying attention and taking care of ourselves. If y'all are up for it, we could think a little bit about the things that work for us to calm ourselves down when we need to. What are the tools that you are using to keep yourself regulated? What are the most basic things that you are doing to take care of yourself? Finding time for hobbies, singing. Wow, that's one that does not work for me because I have a lot of self-judgment there. That's awesome that that's something that works for you. Yoga, taking a walk, multiple people taking a walk, spending time outside. I don't know about where you live right now here in Baltimore. The seasons are changing, and feeling that kind of crisp fall change in the air is a lovely feeling, and it definitely makes me want to be outside even more. A low-key hike, I like that. Not an intense hike, a low-key one. Gardening, petting the dog, right? Sometimes pets are just such a huge piece of being able to help us self-regulate. Exercise, listening to music. These are great examples. These are great ways. And these are the kinds of things, though, as parents that we often feel like we do not have time for, right? And so, what is the way that you can build this in? Do you have time for a full yoga class? You might not. And if you don't have time for that, if you're noticing that your heart rate is increasing, if you're noticing that you're starting to sweat or starting to have a reaction to what your child is saying or doing, can you do a quick stretch, right? Is there something you can do in that moment that really allows you to connect to your body and calm yourself down a little bit before you respond to your child, so that maybe you're more likely to use those strategies? So recognizing that some of these things, these are excellent examples of self-care that as parents, they don't always feel accessible, and thinking about them, what are the quick things you can do before you respond to regulate yourself better. Sometimes it's just a deep breath. Sometimes that doesn't work. So it's looking around the room and trying to find your favorite color a couple of times, right? Those really simple, quick mindfulness strategies that we can engage in. So kind of gave a bunch of different examples of things that you can do as I covered the last few slides. Some of the things that can help to reassure safety is to actually say to your child, you're safe, right? You want to be careful about that because you want to make sure that they're in a situation where they feel safe when you are reminding them that. There are definitely times, though, where a child is waking up from a nightmare, and that reminder is so powerful. You're safe right now. I'm here, right? Sharing the steps that you're taking to protect them at home, at school, or in the community is really important, right? That's part of that building trust piece. You're letting them know what you're doing to keep them safe. Removing self-blame. So really making sure that your child knows that they're not responsible for what happened. Many children internalize blame, even for events that are way beyond their control. And as adults, we often do that as well, right? And a perfect example is if your child's experienced trauma, often we are then saying, it's all my fault that I let this happen, right? We're carrying that heavy load of guilt or shame. And remembering that we are not responsible for it. And even if we are, and what are the things we can do to do things differently moving forward? How can we heal so that our child can heal? And then while they're healing and while we're healing, how can we be patient about that? Every person's healing and recovery timeline is different, right? So we want to be able to support our children through all emotions, recognizing that there are no wrong feelings, and being able to connect to the kernel of truth in those feelings. Like I said before, really thinking about how we're communicating and connecting to our children makes a huge difference. So being able to, rather than, asking lots of questions. How are you feeling? What did you do today? Right? That can feel really intense and overwhelming for a child, regardless of their age. Being able to notice, being able to say, it looks like this is happening right now. It looks like you're feeling this way. 9 times out of 10, if they're not feeling that way, they're going to tell you. And then you have the opportunity to validate. It makes sense that you're feeling this way. Or, of course, you're having that feeling. Even if that feeling is anger, even if that feeling is, I want to fight that person. Yeah, you are angry. After somebody experiences something like you do, like you did, they're angry. It's a normal response. What do we do with that anger, right? I was in a conference last week and somebody said there's a reason why every single movie about trauma has the statement, "It's not your fault," right? And I like immediately went to the Good Will Hunting movie where there's like that scene with Robin Williams and he just like keeps repeating it, Matt Damon sobbing, right? But that piece of removing self-blame, that willingness to be patient with healing, right? Even though there's a lot of that representation in movies, it's there because it's accurate. And so being able to do that is important. And then, like I mentioned before, maintaining that structure, right? Having those consistent routines that really help create a sense of stability and predictability. We know that trauma feels really chaotic. I've mentioned that a number of times. I'm sure you all can recognize that for yourselves or have had experiences where you know that after something bad has happened, everything feels chaotic. So, what are the things that you can do? How do you strengthen some of that consistency and predictability? Routines are a great way to do that, and they offer a lot of reassurance and comfort. The other thing that's really important for self care for caregivers, right? And also that peer support for children is connecting with community, right? So, what kinds of community involvement do you have access to? Being able to access support, whether it's from a religious community, whether it's from your family, right? Often in times of stress and trauma, we want to isolate or shut ourselves down, or we're so worried about safety that we don't want to put our child at risk by going with somebody else, right? And being able to count on and lean on our extended or chosen families is really important. And then supporting engagement in community activities, right? Having those opportunities for your child to feel normal and connected to peers, right? It's really important as well. And if you are somebody or somebody that you're working with is facing a lot of those other systemic barriers, then we also want to think about how can we utilize other kinds of resources, right? How do we make sure that their basic needs are met so that then they can start to do these other things like care for themselves and implement these behavior management strategies and learn about trauma, right? So we know that reduced access can increase the risk of adverse childhood experiences and that reduced resources can exacerbate or make worse those trauma responses. And so we really do want to lean in and lean on community and build that access up. And there are lots of children who go through hard things and they're okay. We don't need to have our child be diagnosed if their everyday functioning is not being impacted, right? They actually won't get a diagnosis if it's not. So, really thinking about when your child's experience is impacting their everyday functioning and when you need support in addressing your child's needs. So it's possible that something really significant happened and you're noticing these changes in your child's mood or behavior. You're noticing that they're more on edge or that they're more afraid or that they're more angry, right? And you're not quite sure that it's affecting them in other settings or that it's really affecting them every day. And you feel like you need support. You feel like you need some help in figuring out how to parent them because their behaviors, their moods, their thoughts, those have changed. So, those are the main ways to know when to access specialized care. You're seeing that everyday impact in your child's functioning, and or you're realizing that you really need some support in addressing their needs. There are these great resources. Like I mentioned before, the National Child Traumatic Stress Network has its own set of resources that are developed for parents and caregivers. And actually, those were just updated and kind of put together in an even better package. And so I included the link for those there. The American Academy of Child and Adolescent Psychiatry also has its own page of parent resources specific to disaster and trauma response. For younger children or for postpartum help, right? There are these other early childhood national networks that can be really helpful and allow for assessment and things like that. And then a lot of times we know that children who have experienced trauma start to have significant challenges across contexts, especially in schools. And I think at least one person here, one person who has signed up is somebody who is focused on education. Really being able to partner with schools in addressing your child's needs is very important. Especially when those needs are driven by trauma, because it doesn't fit as neatly into the boxes that special education rights and laws were developed for. So really trying to find some advocates to support you in advocating the school and rights law is one of those that's been helpful. So with that, I wanted to leave some time for questions and for some conversation. If you have follow-up questions for me or after this, you don't receive access to the slides or to those resources, feel free to send me an email. I will stop sharing now.